Hi, my name is Hannah, and this is my podcast on the impact of historical medical treatment today. And just a little note on who we are. I'm Hannah, a fourth year biomedical science major with minors in medical humanities and human anatomy. And this is my dad, Uppa. His name is Pavi Thomas. Okay, and today we're going to be talking about Medical Apartheid, the book by Harriet Washington. And we're going to be focusing on chapter 4, the surgical theater, Black bodies in the antebellum clinic. And just a little summary of what this chapter is over. It's a discussion and retelling of the stories of slaves who have been mutilated in the name of scientific progress. It includes historical background to help us identify how medicine functions today. And then I know I sent it to you, so what were your initial impressions of this chapter?
It was horrifying. I knew some of the historical background, but to see it in stark detail with names and times and places, shocking.
Yeah, definitely. In this little podcast segment, we're going to talk about two themes we really noticed in the reading: the biomedical model of health, which has four primary assumptions about health. The disease prevention, diagnosis, and treatment are all objective, that only medical professionals can define what health is, that health is the absence of illness, and that health should be defined by physiological impairment. And then the second concept we're going to talk about is detached concern. Detached concern is concern about patient welfare without emotional involvement or over-identification. And while helpful in some aspects, this can lead to a concept called curing rather than caring due to too much detachment from the patient. And so, just going into the first one a little bit deeper, the biomedical model of health and how we saw it appear in the story. Um, for me, what really popped out was the lack of objectivity and how health was defined by if you can work, and that only one type of medical professional is recognized. What were your thoughts?
I agree. It did seem like the one thing that mattered was getting the enslaved person back to productivity. It wasn't a care for the person as such.
Yeah, for sure. I feel like we really saw that in the story of Sam
Mm,
in Alabama,
yeah,
who was having some jaw pain, and then their slave owner ended up giving them this treatment that didn't work and it made it worse. And eventually the Sam was sent to a physician, Dr. Sims, who diagnosed his cancer and then decided to take the cancer out against the patient's will. And I feel like we really see that there.
mm,
Um, Additionally, another one that jumped out to me from the reading was how one doctor, I think it was Dr. Richard, said that amputation should be based on class
yeah.
status.
Mm.
What were your thoughts on that?
Hannah, was that the story where they strapped the patient into the chair? Was that
That
the
was
one?
Sam.
That was Sam, right?
Amputations was the one where a doctor was talking to a group of medical students and said that amputations in white people should be last ditch effort,
Yeah,
but then in black people it is good for them to have
yeah,
amputations because they don't feel pain and
yeah.
because it's good practice for doctors.
Mhm. It's awful. It's that dehumanization, the the sense that enslaved people were simply material to be used for the pedagogical use, basically. That all of that seemed shocking. You know it happened, and yet it put things in perspective. It also creates a tension between what it takes for a doctor to be equipped, a surgeon to be equipped, experience, practice, and actually caring for the human beings that are subject to these procedures.
Definitely. I think that's really how we get to like the creation of hospital medicine is
Mm,
just like the desire to like group everyone together and study the
mm,
people versus like taking care of them and
mm.
like the goal of sending like enslaved people back out into the fields as soon as possible
Yeah, yeah,
without really like trying to give them a more holistic idea of health,
yeah,
including what they want.
yeah. Including what they want. That's right. Their
Yeah.
own their own preferences were not a factor.
Hmm.
Yeah.
Yeah. And I think that really leads well into like the concept of detached concern.
Mm,
And like we talked about, like patients as clinical material,
yeah.
forced experimentation, just like a general lack of consent.
Yeah.
What were some things that stood out to you there?
Yeah. The sense that even physicians who were reluctant to perform procedures on enslaved persons were told that the patient's preference didn't matter. It was only the preference of the owner that
Yeah,
mattered, the slave owner, and which goes to show that they were just property. They were not persons.
absolutely. Yeah, I think you bring up a really good point that like even people who started off with compassion ended up
Yes,
being trained to think of Black people as
the
clinical
system,
material.
the system moved
Yeah.
them in that direction. Yeah.
Yeah. So like Dr. Prey was an example. He went from like feeling really sorrowful, like
Yeah.
dissecting an African American girl in med school
Hmm.
to publishing papers bashing Black
Hmm.
African American women
Hmm.
and like their bodies and like saying that he's like the best because he does like can do
Yeah.
that.
Yeah.
So it's very disconcerting to see that socialization so
Mhm.
fast. And then I think another point I want to talk about is just how like medical school is advertising access
Yeah.
to like clinical material. It's like a
Yeah.
highlight.
Hmm.
Talked about that in the book. And then I've been applying to medical school and in the process of looking at different schools, and I still see that today, which is
Yeah.
really concerning.
What struck me there was that it happens today where poor or disadvantaged people are seen as populations to provide material for hospital training. I'm
Hmm.
sure there's some caring going on, but certainly there's a dehumanizing happening there as well, it seems like.
For
I
sure.
mean,
And I feel
I
like that's
I
really,
wouldn't want to generalize because I'm sure it's pretty complex, but yeah,
yeah, I definitely agree with you. I think that really like pushes how detached concern is like forced on physicians
yeah,
throughout their training. Like you
yeah.
said, it starts with like applying to medical school and be like, look at how many people we have for you to serve.
Mm,
But then you're also like expected to use them in your like research in medical school. And then like they're advertising it as like an asset, which
yes,
is just a little gross,
it
especially
is
with
a
this
little bit.
background.
Yeah,
So currently, I
I
sent you an
can see.
article
Yeah.
called Black
Yes.
Patients Feel Dismissed and Skeptical After the
Yeah.
Experiences in the ED Emergency Department. And the statistics that really stood out to me from that article was that 1 in 10 patients feel their race negatively impacted their experience in care, which
Mm,
is really concerning to me because that article was from this year, like this
wow,
spring.
this is current.
Yeah. And with all the historical background, like talk about medical apartheid, it's really
Yeah.
concerning that that's still current and that
Mm,
there's this idea of detached concern still and like a focus on the biomedical model because in the article it talked about how a lot of patients felt like they're receiving preconceived judgments based on like low health literacy
mm,
levels.
mm. So they're
Yeah,
being categorized by these factors, and yeah.
yeah. And then another parallel I really noticed was in the current indigenous health care system. I sent you another article, Struggle for Hawaiian Cultural Survival.
That
And
was
really,
shocking.
yes, yeah, a really terrifying statistic is that like Native Hawaiians are twice as likely to develop type 2 diabetes, but 8 times more likely to die from it.
Mm.
Just really showcases the health disparity there.
Why do you think that's the case?
The article mentioned that a lot of the cause was due to culturally inappropriate healthcare as well as the historical trauma that these
Mm,
nations faced.
mm,
Very similar to what we've talked about with the biomedical model of
mm,
healthcare,
mm.
only certifying one type of professional as a medical professional. So
Yeah,
that's only like westernized doctors versus like
yeah.
native doctors,
Mm,
which shows a lot of distrust. And then also just like the financial aspects of being like blocked out
mm,
from like insurance and like also a lot of forced poverty to like laws that cause like conflicted with spiritual beliefs and
yeah.
there's so much more like that. And it's really concerning to me, especially because Hawaii is considered the health state for like non-Hawaiians.
Mm.
But then when you look at the data for like native Hawaiians,
Lines. It's very
there's like,
disturbing.
yeah,
Mm,
and also just like the detached concern of like, oh, it's not our problem, we're doing enough,
mm.
or just like that kind of general concept
Yeah,
is still
on the one
applicable to.
hand, it seems like a good thing to be objective, but on the other hand, if that keeps you from actually caring for the patient, then something has gone wrong, right? The
Yeah.
curing should be a function of caring. It
Hmm.
shouldn't separate the two. But yeah,
Yeah, absolutely. I feel like we really see that today
yeah.
still. And then just to sort of wrap up our thoughts, what we've talked about today, we talked about how the biomedical model of healthcare has sort of been
Mm,
weaponized to hurt minorities' health overtly and covertly.
mm,
And something I think that should be utilized more often is the sociological definition of health, which
mm,
really focuses on what the individual deems as like health
yeah.
and helping them achieve that. And also more physician training into systemic health concerns for
Mm,
minority populations. So I don't think that's something we really talk about in any medical education.
mm,
And then also, like we've talked about a lot, how detached concern has its place in medicine, but the
mm.
physicians should be trained in other coping strategies to prevent the dehumanization of patients.
Yes, yes. Makes perfect sense. Yeah, it seems like this is something that ought to be front and center in any attempt to improve healthcare in general.
Definitely. Well, here are citations. Thank
Mm.
you for listening. Thank you for being
Yeah,
here,
no, it was
Abba.
very informative, very informative.
Thank you.
Thank you.
Okay. Bye bye.
Bye.